All right. So we're moving on to talk about these types of pregnancy issues. So this is what is known as what preeclampsia, which is like a version before the real eclampsia comes in. All right. All right. So we are going to discuss the two of them today as pregnancy complications. So for preeclampsia and eclampsia, you're just trying to look at what some pregnancy complications are usually linked to hypertension. Okay. So preeclampsia and eclampsia are serious pregnancy related conditions. So they involve high blood pressure, So the mother is having a lot of high blood pressures, Alright. Alright. Of course, if the mother is having issues, it's a risk to her, and the baby is actually how will I put this? The baby is benefiting directly from the mother, so it's also a risk to the baby. Okay, so let's start with the preeclampsia. So that one is a condition that is typically developed around the 20th weeks of pregnancy. It's marked by blood pressure that is above what? Equal to or above 140/90, and there's signs of organ damage. Often is the kidneys that is usually damaged. Do you understand? So such women, when they urinate, you see the urine will be whitish. That's to show you that there's protein in urine. That's proteinuria. Okay, symptoms is what? Alright, so the mother is having swollen legs. Alright, that's edema. So swollen hands, swollen feet, swollen face. Alright, headaches, visual disturbances, abdominal pain. Then the urine that she's putting out is reducing. So causes is usually thought to stem from abnormal development of blood vessels in the placenta. Alright, possibly it is influenced by genetics. So most people, you have to now ask, other people getting pregnant in your family, do they have the same issue? Then also the immune response and pre-existing conditions, like does the mother already have diabetes or hypertension? So risks, it can lead to what complications such as preterm birth, low birth weight, placenta abruption, then damage to organs like the liver organs, the kidney organs. All right, so this is preeclampsia. So it's characterized by what? Swelling the legs. The urine, if you check it, is whitish. There's protein in urine, okay, and all those blood pressure. Eclampsia itself is a more severe. Preeclampsia was not handled properly, so it progressed to eclampsia. So this one now, she has everything you have in a preeclampsia plus seizures. All right, so it's an emergency. Anything that will make somebody be jerking for seizures is an emergency. So symptoms is seizures. All right, and every other thing you have in what preeclampsia plus shortness of breath, there's confusion, there's loss of consciousness. All right, frequency is rare in well-resourced countries. All right, but it's common in places that pregnant women don't really have the good attention they deserve. So treatment is just immediate medical attention, often involving magnesium sulfate to prevent the seizures, then early delivery if necessary. So management and prevention is monitoring, so regular prenatal checkups to track the blood pressure, the urine proteins, medications like antihypertensives, sometimes low dose aspirin for high risk individuals. So delivery, often the only effective cure, especially delivery, you understand, is the only effective cure, because what is causing it? The woman is pregnant. Of course, once the pregnancy is out, she's back to her normal self, you understand. So that's just it for preeclampsia and eclampsia, which are serious hypertensive conditions in pregnancy.